Hello everyone. As we all know that infertility could be caused by female factor, male factor, and in certain cases both are equally responsible. So, before starting an IVF treatment or any fertility treatment, it is important to evaluate a couple. But you have questions in mind as what test or what examinations you need to undergo. Are these tests necessary? What are their significance? Do everyone has to undergo all the tests and many more? So you'll get reply or answers to all your queries in today's session as we are going to talk about pre-IVF evaluation today. And if you have any questions regarding this, write them in the comment section and I will reply to all your queries. I am Dr. Aashita Jain, fertility expert, Bavishi Fertility Institute. As I said earlier, that both male and female partner is responsible for infertility, so the evaluation of both should be done simultaneously. In evaluating a couple, the first thing comes is the history taking. So let's see what questions we ask in history taking. First comes the age. Age is the single most important factor as it affects the fertility of both the partners. And in cases of female, the fertility potential decreases as the age advances. As the female crosses 30, her egg producing capacity decreases, and beyond 35, it drastically decreases. So, as the female's age advances, her chances of getting pregnant decreases and her chance of bearing a healthy child decreases. So, age plays a very important role. Then comes the married life or the active married life. That is, what is the duration of your marriage or since how long you are together. Now, why it is important? It is important because suppose all the factors are normal in both of the partners. But if the duration is less, then they can opt for simpler methods of treatment. And if the duration is more, then they should opt for the advanced treatment because that is the best option for them. Then comes whether they have taken any treatment in the past or not, what sort of treatment they have taken and since long, because it helps us to guide the future to plan the future treatment. Then the most important part comes in a female history is the menstrual history. That is how a female is having her periods. The periods might be regular or irregular. Irregular like in cases of anovulation, that is in which the female is not ovulating on time, or delayed ovulations. Whether the periods are heavy or scanty, that is very less, or not, no periods at all. Heavy periods occurs in cases of uterine fibroids or polyps. Very less period or scanty periods occurs in cases if a patient suffers from tuberculosis or it has severe adhesion, which is Asherman syndrome, and no menses in cases of a menopausal state. Also, whether the periods are painful or painless is also important because there is a condition in which the periods are very painful and that is known as the endometriosis. And when do you have your last menstrual period? Then comes the obstetric history, that is whether you have pregnancies in the past or you had miscarriages or abortions, have you undergone any D&E procedure, or if you have a history of any abnormal child. It is very important to know. After the obstetric history comes the medical and the surgical history of both the partners, that is whether they are having any pre-existing diseases, they are on any medications, or have they undergone any surgeries in the past. This is all should be known. Then comes family history. It is important to know that whether any of the disease is running in their family. It should be known beforehand. After the family history comes the occupational history. Because certain occupations like the chemical factories, pesticides factories or the radiation centers may affect the fertility potential. In the personal history, whether there is any habit of tobacco chewing or smoking, alcohol, because all these habits affect the fertility. After family and the personal history comes the sexual history. How frequently the couple is having the intercourse, because having intercourse every 2 to 3 days will help to achieve pregnancy early. Whether they are having any difficulty during the intercourse, all this is important. And also the socio-economic and the psychological status of a person should also be considered. After the history taking comes the most important thing, that is the physical examination. Physical examination of both the partners is equally important. In the physical examination of a female, we see the height, weight, BMI, blood pressure, breast examination, thyroid, that is whether there is any swelling in the neck or not, and the internal examination, that is per speculum examination, in which we see the mouth of the uterus, that is known as the cervix, whether it is healthy or not, or is normal or not. Then comes the physical examination of a male partner, and it is equally important. In the physical examination of the male partner, we see the size of the testes, or whether the testes are present or not, whether testes are normal or large, because small testes, that is the testicular atrophy, or the larger testes in cases of hydrocele, may affect the sperm count. We also see the condition of the penis, whether there is any injury or abnormality. All this should be examined thoroughly. After physical examination comes the ultrasound. The ultrasound of a female is done transvaginally. Ultrasound will help us to know the size of the uterus, the shape of the uterus, internal lining of the uterus, whether there is any abnormality inside the uterus like the fibroids, polyps, or any adhesions, which we can make out on the sonography. It will also help us to know the condition of the ovaries, their volume, their egg producing capacity, that is the AFC, which we say antral follicular count. Are there any cysts present in the ovary, either the simple cyst or chocolate cyst? And in certain conditions like the PCOS, in which we see multifollicular, small multiple follicles in the cyst. There are certain conditions in which the conditions of the tubes are also seen, which are known as hydrosalpinges, in which the fluid is filled in the tubes. It can also be ruled out on the ultrasonography. In certain conditions, ultrasonography for male partner is also advised, like in cases of varicocele, or if any abnormality is detected on physical examinations, called scrotal ultrasound is advised. Now comes the investigations of both the partners. In the investigations of a female partner, we advise hemogram, blood sugar, blood group, viral markers, liver function test, kidney function test, thalassemia screening, urine routine micro, hormonal assay, which includes the TSH, that is thyroid stimulating hormone, serum prolactin, AMH, that is anti-Mullerian hormone, which suggests the ovarian reserve of a female. Certain hormones are done on the day 2 of the menses, like the FSH, LH, and the estradiol. In certain circumstances, we advise immunological test and karyotyping. We never advise immunological test on the first go. There are conditions where immunological tests are important, like in cases of recurrent implantation failure, that is, the patient has undergone number of embryo transfers but has not succeeded, and the second condition in which the patient gets pregnant but unable to carry the pregnancy forward. These are the conditions where immunological tests like the antiphospholipid profile are very important. Then the investigation of a male partner includes the most important is the semen analysis. Semen analysis, we see the sperm count, sperm motility, and the morphology, that is the shape of the sperms. It is the most important test in the male partner, as it will help us to decide the treatment. In blood investigations, we include complete hemogram, blood group, blood sugar, viral markers, certain cases thalassemia screening, and in cases of low sperm count or zero sperm count, we advise hormonal tests like testosterone, LH, FSH. In these cases, we might also advise the genetic screening or the karyotyping and the semen culture. So all these are the blood investigations which are very important for both the couples. Before starting the IVF treatment, there is one more important test for a female, and that is known as the hysteroscopy. Hysteroscopy means the looking inside the uterus with the help of a small scope. In this procedure, we look inside the uterus for the lining of the uterus, any abnormality, like if there may be any fibroid, polyp, adhesions or septum present in the uterus, and if any abnormality is present, it can be corrected at the same time. So it forms a very important part of investigation. So all these investigations which we discussed in the evaluation part is very important before starting the treatment, as it will give us the direction, it will guide us to plan the treatment according to the couples, or it will help us to individualize the treatment according to a couple. So if you were in the dilemma whether to get the test done or not, get out of it right now and get your test done and start your fertility journey right now. And still, if you have any queries, you can write them in the comment section and I will reply to all of them. Thank you.